Welcome back to Care Beyond Code, the show from VBA, where we talk about the strategies and decisions which inject humanity back into the healthcare system, making the experience better for everybody. And today I have two more high-impact stories where the administrative side of the industry made a patient's journey better through an organization with a slightly unique perspective into this world, custom design benefits. Today I'm joined by Alberta Manga and Miranda Booter from that organization. Alberta, Miranda, great to have you on the show.
Thanks for having us.
Thank you, Adam.
Let's get right into it. What makes custom design benefits a little bit different from other players in the TPA space, and how is that advantageous? For one, I know that you have your own in-house management. I'm not sure how common that is, but I'm not the expert here, you are. So if you could just give us an overview of the organization and your perceived strategic advantages as to how you provide care, would love to know that as a foundation.
Absolutely. Custom Design Benefits is based in Cincinnati, Ohio. And our groups are businesses that have headquarters in Ohio, Indiana, and Kentucky. And some of these groups have members in all of the 50 states. We provide reference-based pricing to 65% of these groups. And 35% of the groups have a dual option, where it's the true cost plan, which is the reference-based pricing that we do, as well as a PPO option. So we utilize technology, data that helps us manage shock claimants, like based on their high claim pharmacy or their medical claims and their chronic conditions. This data is able to help us manage all of our members, especially the ones with high potential of being admitted. So internally, we do medical management, which is rare for most TPAs because they outsource those provisions for medical management. So we do the utilization review in-house, the case management in-house, patient advocacy, and the claims. So we're able to see all of this data to help our members.
And as Alberta said, most TPAs outsource their medical management department. So it's advantageous in collaborative efforts with internal departments. So say if I have a member on the phone who's having issues with claims, that day I can go ahead and reach out to our customer service specialist and get that taken care of, and that way there's no moving parts going or just getting lost in translation, and we're able to reach out that day to assist a member.
And so when it comes to the use of technology and the transfer of data, I'm guessing that in most situations that can be a lagging factor to get quick, efficient, effective care to the end member. But this in-house management being, let's say, uncommon compared to most, allows you to do that a lot more quickly, or maybe it's not even an issue at all. Is that correct? I'm sure most of the people that are watching this are going, yes, Adam, obviously, but just to make sure.
Absolutely. Because based on the data that comes in, it generates the members that we need to reach out to immediately. So we get those monthly feeds, daily feeds on high claimants that comes into our population health queue for the case manager to make that outreach to them and touch on them immediately.
So I have to ask about something I was talking with Julie Miller, the CEO of Custom Design Benefits, a little bit before the conversation we're having today. And she said that most of the prowess in terms of technology and data in the CDB universe is mostly to administer and prevent the train wrecks of tomorrow. Can you talk to me a little bit about what that phrase means and practically how you're able to do that?
The data that's provided creates predictive modeling. It anticipates that these members that are identified could be readmitted 25% high risk of being admitted into a hospital. The inpatient stay is the highest cost for any insurance company. So we try to prevent that by making outreaches to those members, because obviously they have chronic conditions. Do they know how to manage it? What resources do they need in the community for them to be successful? Do they know when to go to emergency room versus going to the doctor's office? So those are the things that we educate those members that are at high risk of being readmitted or getting inpatient stay.
And so when we talk about avoiding those train wrecks, in picking up a few stories that we're going to go into right now, everybody who's been listening to Care Beyond Code knows that we go into a few of these super high impact human touch moments. It seems to be mostly about avoiding these shock cases. And yes, perhaps data and perhaps technology plays a part in that, not just in predicting what yet is to come, but also assessing what is the present is part of that. Another topic of conversation that I found in researching prior to this is learning more about the social determinants of health, things that aren't necessarily related to the condition as it happens, but to the environment around the patient. That either seems to be popular because it's actually impactful or it's a buzzword. I'm not quite sure, but I know that that's something that you also prioritize in the organization. Before we get into these high touch impact moments, could we talk a little bit about how you gauge those determinants of health in making the decisions that you make through the in-house management?
So with the social determinants of health, of course, a lot of the times you just can't look at clinical records and see where the issues lie. So, for example, you can be on the phone with somebody following a discharge and realize that there are some non-medical factors that are impacting their health, whether it be lack of transportation to doctor's appointments, lack of nutrition, or anything like that that can really impact a member. That's going to be one of the basics of what they're needing. And a lot of the times they don't know the actual community resources that can assist them with that.
We'll go into a little bit more of what that means on the ground in the second of these two stories. But audience, again, we are used to sharing the full spectrum of what care beyond code can truly mean through the stories of real people. And thanks to our guests today, we have two of those. I'm going to set the scene for both, and then I'm going to let you both tell us the innards of the story since you were directly firsthand participants in it. We'll start with case number one. Case number one, a 38-year-old male with a condition that most fellas can relate to, a serious one, testicular cancer, especially at a point where you're considering maybe having a family. I'm not quite yet to that age, but I am in that stage of life, and so this story hit me particularly personally. But why don't you set the scene for us beyond that initial condition and talk us through what happened in this case, what the code would have normally suggested people do, and how you went above and beyond to administer your own care.
Right. So this case is about testicular cancer, and this is one cancer that happens to 6 out of 100,000 males in each year. And early detection really leads to a better outcome. It's important that those males between the age of 20 and 40 tend to see their doctors every year for this annual checkups through their primary care physicians. There's lab work that's involved, there's scans that are involved as well. So within that age group, it's important that doctors are assessing that, and you as a male within that age group know to ask your doctor about beginning those checks. So Miranda will go into the story and how this impacted this member.
So I reached out to this member due to finding out that he had just been diagnosed with a testicular cancer. And so when I called him, he was still in the process of not really knowing what his current treatment plan was going to be. He still had some follow-up appointments to go over results. So I educated him on some potential treatments he may have to go through. I also found him some financial assistance as well as education from disease foundations that he can utilize on his journey through his treatments. Also, one thing that we ended up coming across later on was that he opted for surgical treatment instead of the chemotherapy. Unfortunately, he was going to an out-of-network hospital in which he was going to obtain this surgical procedure. When he called me to let me know about this, I went ahead and got the updated clinical documentation as well as a pre-certification request needed. That way we were able to talk to the patient advocate that we have in-house as well to secure a single case agreement.
Now, a single case agreement, that you mentioned at the top that a lot of your work is done with reference-based pricing. This is separate from that?
Yes. It's separate from that. It's in combination with that because there's some facilities that would not accept the reference-based pricing. So we do a single case agreement for those procedures. And this ensures that this guarantees the payment that's going to be in place after the procedure has taken place, right? The member does not get any surprise billing, and the group knows exactly what they're paying. So this is a true way to ensure that nobody is stressed. The group is not stressed with a higher cost, and the member doesn't have any surprise bills coming their way.
That feels like it should be the standard second practice beyond like some sort of group reference-based pricing structure. Is this not what is normal? Is this common?
It's common for those with reference-based pricing to be able to make those arrangements ahead of time so that the member doesn't end up with, well, balance bills at the end when that facility simply declines to take what we reimburse, the rate we reimburse them at.
Okay, yeah, that's good because I would think that obviously we're talking about a condition which is serious. We're talking about long-term health implications. We're talking about a stage of life. All of these things can create an emotionally vulnerable situation. You certainly wouldn't want to be financially vulnerable in the face of that. And so in this out-of-network situation, which anybody that hears those three words knows just means, oh, bills, 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 right? And way out of my control. The fact that you can work out a certainty ahead of time of what that's going to be, while it might not be exactly the price you thought it would, is at least known. And so taking away those unknowns in a field of unknowns sounds like something which is advantageous no matter who you are, no matter what the situation is. So I'm glad you were able to do that. And so this patient understanding this single case agreement proceeds with the procedure. Miranda, continue the story for us.
So that same afternoon, this all took place within a 3-hour span as well, because we were so close.
Within a 3-hour span?
Yes.
But
So
that's the other thing. I would have assumed this thing would have taken like days and weeks, and that would just weigh on you while the condition presumably worsens. No?
well, the member contacted me that afternoon and let me know that he was a little frustrated by the fact that his surgical procedure was going to be out of network. And at that point, I went over and I spoke to the patient advocate who was directly across from me, and we discussed the situation and what needed to be in place for her to start up that single case agreement. After that, we were able to go ahead and contact the doctor's office and have them submit the information needed, which would have been to the pre-cert request with the clinical documentation. So I spoke with our utilization management specialist, who was able to notify me as soon as this information came in. I was able to review the information and get the information over to our patient advocate to start that process. She was able to contact the member that afternoon to let him know that she was starting this.
So you were just able to go a couple chairs down and say, hey, here's the situation, and have a solution made in a relatively short amount of time. And help me to clarify this. This is the direct result of the in-house management. Yes, if somebody were to outsource this, it could take much, much longer. You're talking about, forget multiples of time, because, you could get to several multiples of 3 hours before you just get to a day. But we're talking about potentially days or longer to get to where you got to in an afternoon otherwise. Is that fair to say?
Absolutely. Absolutely.
Well, a nice temporary relief in the face of a mountain of stress for this particular patient. This decision is made quickly. The single case agreement is drawn up, and then the procedure is done. But of course, that is the beginning of a whole new phase of care that needs to be administered. How were you present with this patient through that procedure and afterwards?
I was able to contact him. He had told me when his surgical date was, and we also had the pre-cert request with the date on there. So 2 days after that he had his surgery, I was able to contact him while he was still in the hospital, just to check up on him, make sure everything went well, that he was able to obtain the surgery. And then I also did a transition of care call following discharge to make sure he had everything at home, and just discuss, if there was any, future treatment plans in place yet. Made sure he had his doctor's appointments scheduled, he was good with transportation, and just to make sure he was set for that next stage of his treatment.
And what is available to somebody after a procedure like this? Because I think about my world, I think about somebody, in my rough stage of life. They're thinking about a number of things, but probably the most obvious is like, I got to get back to work. I got to make sure that I'm minimally impacted by this. And many of the stories that we've had on Care Beyond Code so far seem to turn back to that, which is getting back to work as quickly as possible. Is that all based on assistance that you directly provide, or similar to those resources at the beginning, which you were able to direct the patient to? Were there other similar resources that this patient was maybe not aware of that you were able to point him to afterwards?
Well, if the member had needed something else to assist with home care, maybe after this procedure, we were able to initiate that, make sure everything's going well. Thankfully, he didn't need the home care. He was younger, and he was able to discharge home appropriately where he was more comfortable. There are times where we can find that assistance in the community. So there are some community-based agencies that'll help them get up and running.
Well, it sounds like you were there with this patient for most of the way, if not all. I guess to try to put a nice bow on this, how's the patient doing now? Are you still in touch with him?
He's actually doing great. He calls me at least every 2 or so weeks. We contact each other just to make sure everything's going well. He even contacts me on his own.
Is that common for somebody? I can't imagine somebody going out of the way. Let me call my case manager again.
Well, the great thing about everything being in-house is we are assigned, each company is assigned a case manager. So the employees know who to contact. And they also have a face with the name. And I think right there, it builds more trust and establishing a relationship with these members.
Right.
They have my
I'm not
direct
just calling
contact
some
number
faceless
and-
number. Right. And then I don't know who I'm talking to, and I might talk to somebody totally different. I don't want to go through the burden of having to retell the story or worrying that maybe they don't have the context or something didn't get transferred properly, blah, blah, blah. All of the hassles that, I sometimes cynically, skeptically think of, I might not have to go through if I were part of your universe. So that's good. And also I would think uncommon for somebody to keep coming back, but hey, maybe that's just the power of the care above and beyond the code. Now, I was asking about some of those programs post-procedure and how you pointed or could point somebody towards those, because as we were talking about a little bit earlier, there are social determinants of health that go above and beyond the impact of whatever condition causes the care to be needed in the first place. It's a good transition to this second story we have, which is a condition which is a little more familiar to anybody, no matter your stage of life, no matter if you're a man or woman, and that is a ruptured appendix. My God, that happens to almost everybody. It feels like an emergency situation. You need care right then and there. Plenty of unknowns and immediate unknowns. Could you tell me a little bit more about this particular story? Similar aged person, a 39-year-old male, but needed some help.
So I contacted this member for a transition of care call after discharge, like you said, with the ruptured appendix and sepsis. And he told me he was doing physically fine. He was healing well, no issues with pain, denied any kind of signs and symptoms of infection. But he did tell me that he was having some anxiety regarding his bills. He said he was worried about keeping the electricity on after not having been at work for that past week, as well as any kind of upcoming expenses he may have incurred from the hospital stay. So what I was able to do with this member, I did give him some community resources that was able to assist him with his electricity, as well as any other kind of emergency food he may need in the upcoming weeks until he's back on his feet. And also we were able to contact the hospital together and get placed on a payment plan with their patient assistance program just to make sure that he was able to get those taken care of and one less thing on his shoulders he had to worry about.
On this show so far, we've spoken, and I'll just be out with it, we've spoken with a lot of people at the executive level, people at the management level of these organizations. This show is being put on by a technology company. And at the end of the day, it is crucial to remember and always keep at the front of our mind. And no matter whether it's me, no matter whether it's you watching this show right now or listening to this show, that keeping the lights on is a real concern for a lot of people. That's something as I'll say mundane and routine, just because it's such a universal experience as having an emergency appendix rupture can sideline you and your family in more ways than one. And it's interesting how many times for me on the host side of this conversation, it's come back to an awareness gap. How little the patient is actually aware of the assistance that they can get. That's far and beyond any claim to an insurance company that needs to get processed. That is a human touch in and of itself. And so the fact that you were able to, find the resources for that person, point them in the right direction, is great. And it cannot be undervalued. The same, for me at least, stands for a payment plan from a hospital. This is something that I didn't know about until I was well into my adult years. I didn't even know you could do that. I was like, you can go on like installments with a hospital. The bill just doesn't come, and it's like, if I don't pay that, like ... And it's amazing how many people don't know that is an option. In your experience, I'm curious, you work with, a load of patients. I don't know how many people that you individually work with, but I'm curious, in what percentage of cases are people just not aware of some of the solutions and assistance available to them?
I think there are a I would say a good amount of people who actually express a need for case management who were not aware of what is available in the community. I think a lot of people, when they come across a new diagnosis, they are so overwhelmed with the information that, they're getting a ton of information thrown their way. They're still worrying about it, and it's hard for them to absorb it. So with this additional community resources, or even the education-based websites that you have from foundations like for diabetes, heart disease, a lot of people don't know that those are out there, and they're just a click away, and that can alleviate a lot of stress for them.
And beyond an awareness gap, the secondary chasm of care that I've perceived again on this side of the table is the action gap, which is you may become aware of a payment plan possibility with a hospital, but then there's the daunting task of actually picking up the phone and feeling like you're in a negotiation with somebody who has done thousands of these, and this is your first time. In fact, you're still recovering from the one condition or procedure that you had. Were you on the phone too? Like, how exactly does that work? How deep does that rabbit hole of like in-house by hand care go? Were you negotiating on behalf of the person? Were you just coaching them through it? How does that work? Talk me through that for somebody who has not called a hospital before and been through that.
So a lot of my members, they just want the information, but this particular member, we were able to do a 3-way call with the facility. Therefore, we were able to talk with them together, let them know that, hey, I had this inpatient stay from this date to this date, and I need to be put on a payment plan, and help to walk them through what was needed, whether it was financials.
Having that professional person guide this layman who cannot speak the lingo, like verbally, to the hospital, also help them. And that's why at case management, when the members know we're involved, it's like the next family member who can speak for them. And the 3-way call ensures the facility knows that this person has given permission for them to be spoken to, right? And spoken for their sake. So it was an exception. It was a very good situation for this member, alleviating their stresses on financial basis.
Aside from having your own in-house management, which sounds like it could be a best practice for the fastest possible data transfers and the fastest possible decisions to be made, what advice would you have going forward in terms of standards of behavior, standards of practice, which can help to create the best care beyond code situation possible?
Here at CDB, Custom Design Benefits, we really believe healthcare should be accessible, efficient, and most of all, compassionate, right? Utilizing and combining expertise, innovation helps to deliver a comprehensive solution, right? It optimizes costs, it improves outcomes, it enhances the member's experience. It also improves relationships we have with providers because we know the members' doctors, we call them, ensure that these members are successful in the community. We work with them to provide that care plan and help monitor the care plan for that provider. So it's really crucial that plans, combine innovation and expertise. Invest in clinical expertise in your organization.
Well, whether it be a story arising from an emergency condition or one requiring a long-term timeline and long-term care, I'm glad to be able to showcase these two stories from you both to talk about what care beyond code means to you and what it can mean for others. Folks, a quick reference to say that this is what we care about at VBA all the time as well from the administrative side. That's why we exist as a company. That's why we're telling these stories, because we do think in a world of accelerating innovation on the data side and technology and even all those multi-letter acronyms like AI and everything else, a human touch is still critical to the process. You just need the tools to make those a little bit more efficient so that at the end of the day, you can call up a dedicated case manager every couple of weeks and, give an update so that you can be efficiently handheld to a hospital and be able to talk about something like a payment plan so that those moments are not lost in a world of increasing pace and urgency. And so if you are interested, you're in the industry side of this and learning more about VBA, VBAsoftware.com. For now, for learning about everything that Care Beyond Code means to you at CDB, Alberta Miranda, thanks so much for joining.
Thank you very much, Adam.
Thank you.
We appreciate it.